Good morning, VI. Do you know the condition that's the leading cause of kidney failure, lower limb amputations, and new cases of blindness among adults in the United States? Well, if you guessed diabetes, then you guessed correctly. Today on Good Morning VI, we're going to explore the sweet and lowdown of diabetes. Stay tuned to Good Morning VI.
It's time to tune in. Yeah. This is the day the Lord has made. Rejoice and be glad in it. Yeah. Hey! Good morning, VI. Good morning. Wake up. It's time to tune in. Good morning. This is the day the Lord has made. Good morning, VI. Good morning. Wake up. It's time to tune in. Good morning. Healthy living, money matters. It's the world around us.
Good morning and welcome to Good Morning VI. It's the morning show for you to start your day right and walk through your day right. I'm Denise, and as always, along with Lisandra and Dolace, we aim to inform you and inspire you as we cover a variety of interesting topics important to our everyday lives and our community, like healthy living, green living, education and family, even money matters. Well, on today's program, we are going to open your eyes. Open your eyes and hopefully dispel some misconceptions about diabetes. We are going to have a diabetes talk. Well, the health and well-being of our viewers is really of great importance to us on Good Morning VI, and we always encourage it. That's why today we're going to have a medical expert who's going to talk about the facts as well as some fiction about diabetes. Isn't that right, Lisandra?
Oh, yes, it is. And you know what? I think each and every one of us has been touched by diabetes in some way.
Yeah, we all know someone.
Yes. So it's very important that our viewers watch today so we can all understand how diabetes can be prevented and how it affects us.
Yeah. Well, you know what? I'm already learning, right? Because just at the beginning of the show, in talking to our medical expert, I found out she's an endocrinologist, and I didn't know that was the medical specialist that you normally go to see for diabetes-related problems. But as always, despite what we say on the show, right? Our viewers should always go and check with their own physicians before
that's very
following
important.
anything.
Definitely.
Any
Well,
suggestions on our show.
And before we get to all that, as always, we always want to start the day right. So we start with a prayer, a scripture, and a word of encouragement. And Lisandra translates the scripture and the prayer for our Spanish-speaking viewers. Father, in the name of Jesus, we thank you for the gift of faith that grows within us as we study your word, and for giving us the wisdom to make right choices that bring balance and victory in our lives. We thank you, Lord God, for your divine favor over our lives and for every single blessing so that we can walk in love, peace, and joy and be a blessing to others as well. In Jesus' name, amen.
Padre, en el nombre de Jesús, le damos gracias por el regalo de la fe que crece dentro de nosotros mientras estudiamos su palabra y por habernos dado la sabiduría para tomar decisiones correctas que traen equilibrio y victoria en nuestras vidas hoy. Le agradecemos su favor divino sobre nuestras vidas y por cada bendición única, por lo que podemos caminar en paz, amor y alegría y ser una bendición para otros. En nombre de Jesús, amén.
Amen. And today's scripture comes from the book of Matthew. That's Matthew chapter 17, verse 20. He replied, "Because you have so little faith, I tell you the truth. If you have faith as small as a mustard seed, you can say to this mountain, 'Move from here to there,' and it will move. Nothing will be impossible for you.
Mateo 17:20. Jesús les dijo, por vuestra poca fe, porque de cierto os digo, que si tuviereis fe como un grano de mostaza, diréis a este monte, pásate de aquí allá, y se pasará, y nada os será imposible.
Well, and that brings us to our word of encouragement, which is also about faith. And our word of encouragement is, your faith in God will work for you. There is no need for you to rely on someone else's faith, since God has given everyone a measure of faith. Exercise your faith by speaking it and bring the change that you want into existence. Well, that's encouraging about faith. It's this one thing about the scripture when they talk about faith as small as a mustard seed
Very small.
can move mountains. I remember one day in church, they passed around a mustard seed.
Oh,
So you
wow.
can see really how
Tiny.
tiny it is, right? And so, we can feel comfortable that, it really just takes a little bit. You don't have to feel like so many times we say, oh, I got to go to somebody else who has a lot of faith to pray for me or to do. You don't always have to do that, but we all of us have gotten a measure of faith.
Yes.
Yes.
So, and as small as a mustard seed, we can just exercise that and move mountains.
Yes,
Each one of us.
And you know what? Even that small mustard seed can give us hope.
Yeah.
And today's show, we're talking about diabetes, but knowing about it, and understanding the disease can give us hope and increase our faith.
Yeah.
Exactly.
And for me, faith is not a feeling. Faith is an action. And so, one of the things we'll learn is to be proactive about managing our health and well-being, right? To avoid or to deal with diabetes issues. And to me, that's an act of faith right there.
Oh, yes.
That's right, it is. It does require that kind of faith and that outlook of knowing that, hey, and hope is faith. It's it is that hope and knowing that, hey, even if this may touch you or somebody that you love, that you can live quite very
yes, a
fulfilling,
wonderful
enjoyable,
life. Yeah, you can
active
live a full
life
life.
Yes.
along with it, just as long as you take care of it. And that's
Yes,
one thing
and that's the
about
most
it.
important
But it's
thing.
so important to know about. So we're looking forward to that.
Knowledge leads to faith. Is
That's
this
right.
what you're saying to us,
Yes.
Denise? The more you know, the more you can
That's
believe.
right. The
And
more you
faith and hope,
know,
they spell fair, which
Yes.
exactly
is what we don't want to have.
That's right. That's
Yeah,
right.
yeah,
And we can rely on that. Even if your faith you think is as small as a mustard seed, hey, you got it,
Mustard
right?
seed faith. A mustard seed, mountain moving faith. Okay, I like it.
Yeah.
It'll work.
Yeah, we can move mountains. We have that kind of power. It's
We have
good
that
to know
power,
that we
right?
have that power.
I know.
Each
And
and
we
every
do.
one of us.
And we have to
And
believe
that's
it
good.
because it's there.
And
Have
it's
you ever
important
moved
to
a
speak
mountain
it.
with your faith, Denise?
If I ever moved mountain, I've moved many a mountain.
Oh,
wow,
yes.
wow.
Oh, yes.
I'll tell you, once I
Faith.
decide, no, really, once deciding, I mean, I was in a place before, like when I felt like, oh, well, this person had so much faith in this person, but, and I came to a realization, also, even Pastor Dell had even said, look, you guys, don't keep coming to me. Go
That's
pray
true.
for
Pray for
yourself.
yourself.
You know,
She says that
you
all
got
the
it,
time.
and really believing that and exercising it and really standing and speaking it.
Yeah.
Oh, it's worked wonders.
Yes.
Oh, wow.
It's really worked wonders. So I mean,
Faith-filled
I'm still a
life.
work in progress,
Yeah.
but I'm just saying.
Aren't we all?
I'm just
We
saying.
all.
Yeah.
Aren't we all?
Okay, well, coming up next, we are going to continue with our diabetes talk with our medical experts, so you cannot miss it. Coming up next, stay tuned. Good Morning V.I.
Yeah, 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 yeah. Hey! Good morning, V.I. Good morning, morning. Wake up. It's time. Yeah, yeah. Hey! Good morning, V.I. Good morning, morning. Wake up. It's time to tune in. Good morning.
Good morning, VI, and welcome back. And today on Good Morning VI, we're doing a diabetes talk. And we have a special guest who has dedicated her life to knowing the disease, Dr. Judy Barzi. Welcome, Dr. Barzi. It's good to have you with us today. And Dr. Barzi is a board-certified internal medicine, as well as board-certified in endocrinology, diabetes, and metabolism. Dr. Barzi was born in Montserrat, received her medical degree from Tufts University School of Medicine in Boston, Massachusetts, and her fellowship in endocrinology at UT Southwestern Medical in Dallas, Texas. In June 2009, Dr. Barzi closed her private practice in South Florida and relocated here to St. Thomas with her family. Wonderful, and that was really good for us.
Yeah.
Yes, Dr. Barzi, tell us a little bit about what is endocrinology?
Endocrinology is a specialty in medicine that deals with the hormones and all the glands in the body. So in order for the organs to work right, hormones and the glands that regulate them operate through these hormones. So endocrinology just takes the place of all those hormones, and diabetes just being one of the most prevalent conditions that we deal with in endocrinology, but it's not the only one.
Okay, what others do you deal with in endocrinology?
There's thyroid problems, anybody has thyroid problems. So females who have infertility, or men too who have testosterone or fertility issues. There's also pituitary problems, adrenal problems.
Okay,
There's
yes,
a
okay, so
lot.
everything to do with the
Yes,
glands.
cushions. Every gland is functioned by the endocrine system, basically.
Okay, what really brought you to specialize in endocrinology?
We mentioned earlier Montserrat. That's where I'm from. That's where I was born. So when I went off to school, I wanted to be able to come home, to be able to go back to my island, to be able to give service to my people. And you have to come home with a specialty, because Montserrat, as you know, is a small island quite like St. Thomas. You have to go home with a specialty that you can serve a lot of people with. And so endocrinology fit that very well, because it involves different things, but not too many complex things that need a lot of machinery or a lot of, it just needs the person, the physician.
Oh, okay. And you know, Dr. Barzi, there are a lot of viewers out there who have a lot of questions about diabetes. And the first question we have from our viewer is, can my diabetes go away on its own?
Well, unfortunately, no. Once you're diagnosed with diabetes, there's no cure. So you will always have diabetes once you're diagnosed with diabetes.
Well, I have a situation of a friend of mine recently. She was diagnosed with diabetes, much to her surprise and dismay, of course.
Yes.
But after that, they put her on insulin, where she had to give herself shots. In about 3 months, during that period, she cut down on a lot of starches and everything in her diet. She lost 12 pounds, went back to the doctor. They took her off of medication.
Oh, wow.
So
How does that
what is
work?
that? How does that work, and why?
So that's another common misconception. So she can be off of medicine, whether it be insulin or pills, and that would not mean that she is cured of her diabetes. It simply means that she still has diabetes, but it is well controlled with lifestyle, which is one of the key components. You know, your exercise and your eating right, losing a lot of the weight is imperative, and so she's well controlled, but just simply with lifestyle.
So she's not medication dependent, but she still has.
Correct. She still has diabetes.
Okay, so it doesn't go away on its own,
It does not
essentially.
go on its own, unfortunately.
Okay. So tell us what is diabetes? We're talking about it, we're using the word. What is diabetes?
Well, in a simple way to try to explain it, diabetes is when there is a mismatch, basically a misbalance of insulin and glucose. And so if there's too little insulin around, there's too much glucose, and one has to use the glucose effectively. All of our millions of cells use glucose for energy. So if you're not able to take the insulin as the key, as I say, and use it to get it to the cells, then you have what? Too much glucose in the bloodstream. And so that's what diabetes is. It's high sugars, high blood glucose in the blood, because the insulin is not able to work properly or to dispose of it.
Okay, and we have a slide, and you know the title is what it is and why it happens, and I think you just described it very well. I mean, this is why it happens, because the glucose is
Because there's an imbalance, there's an imbalance between the glucose and insulin. And insulin acts like a key, like I said, it acts like a key in order to get glucose into the cells. And as the glucose has to get into the cell, if the insulin is not enough, insulin around, then it can't work right. Or if the insulin is there in abundance but not working properly, then they won't get the glucose into the cells. And what did I remember? I just said that the glucose is necessary for energy for the cells. All of our cells need glucose for survival.
What causes this imbalance? What causes it to happen?
We don't have, we don't have a reason. Now, the latest journals that came out on this trying to say that what is it, why is it? Is it because someone's overweight? Is it because someone doesn't eat right? There's too much out there. We still don't know. There's a lot of data out there as to not knowing why. One of the biggest studies actually showed that you have someone who's twins, identical twins, and one has it and one doesn't. So genetics are not the only thing. What they're postulating now is that also there must be something in the environment. So you must have a family connection, must have some reason for that, but then the environmental clue, which is what is that? We don't know. Is it some of the plastics? Is it environmental pollutants? We really don't know what it is that triggers in some and not in others.
So Dr. Barzi, I love sweet things, right? I love sugar. Okay, like cake. In fact, I don't eat the cake, I eat the frosting. Is that gonna cause diabetes? I mean, it's called sugar, right?
Yeah, that's a good question. It's a very good question. No, that won't cause diabetes unless you have the setup to have it. Exactly. So you have to have that genetic component, and then something in the environment could trigger for you later on. So you always want to make sure that you have the sugar, the frosting in moderation.
In moderation. So it could be a trigger then? It could be a trigger then.
Sorry?
Is what you're saying? It could be a trigger?
Well,
if you're predisposed to it, eating sweets could be a trigger.
Well, if you're predisposed to it, then what happens in the environment trigger is that you then can go on to gain more weight. And if you gain weight, then the fat deposits in the incorrect places. And whatever that other triggers are, that's what can then cause it to happen. So it's not to say we'll tell our kids now, oh, don't eat any sweets because you'll have diabetes. That's not going to be a correct perception. Live right, live healthy, eat in some kind of balance, and then you go from there. But yes, an overabundance of anything, can cause a problem. So you don't want to do that.
What tests do you have to undergo to find out that you do have diabetes? I mean, I know, the little machine, the glucose monitor, is that the only test?
No, so sometimes what's more important before the testing is, well, what do you feel? You have someone that's coming to you and they're saying, well, I don't feel good. I feel tired all the time. I feel weak. I'm losing a lot of weight. And girl, I was trying to lose a lot of weight, but I'm losing a lot of weight. And then people get concerned when they start losing weight and they didn't intend to. At some time, they will then decide, okay, let me see what that is. So a lot of weight loss, urinating a lot, drinking a lot, being thirsty a lot, and sometimes just feeling overall not yourself. Just feeling sick, just don't feel good. You got to check up head to toe and you still don't feel well. That's one of the first things that one needs to go. And a lot of people that go to the doctor for a checkup don't get the blood test that is necessary. Sometimes they need a simple blood test that will tell them whether the sugar levels are too high or too low. And so those are some of the first diagnostic tests that you need. In order to be followed, then you need tests every 3 months, certain tests called the A1C.
Yes.
Anybody heard of what that one is?
Yes.
Yeah. The A1C is a test that tells you over the last 3 months how well or how poorly controlled your diabetes is. And so that's key for anybody being initially diagnosed and then in order to follow to see how your plan is working, whether your medication or your lifestyle, like your friend with the exercise, is working well or not. And so that's what we would use. It's very important also, the other tests that are mentioned is your cholesterol. Your cholesterol numbers must be within certain targets because diabetes, it basically mingles with the heart. And one of those leading causes of problems in diabetes is, like you had mentioned at the outset, heart attack and heart disease. So you want to make sure your cholesterol profiles and cholesterol numbers are checked and keep in good order. Certain goals being met.
Okay, and Dr. Barzi, we'll be right back with you and we'll continue with our diabetes talk on Good Morning V.I. So stay tuned.
It's time to tune in. Yeah. This is the day the Lord has made. Whoa. Rejoice and be glad in it. Good morning. This is the day the Lord has made. Good morning.
Welcome back to Good Morning V.I., where we have with us our endocrinologist, Dr. Judy, not Judith, Judy Barzy. Right, Dr. Barzy?
That's correct.
All right. So we've been talking about diabetes, and one of the things I wanted to ask you, how do you manage diabetes? You know, so you get this diagnosis, you talk about lifestyle. Are there other ways to manage your diabetes?
Well, I think the important point that we want to bring out with that, and we had some slides to show that, is that taking care of your diabetes simply means exactly that, that you are a captain of your team. It takes a team effort, and you're going to have a group of healthcare professionals, so your internist, your endocrinologist, perhaps a nutritionist if there's someone that you're able to see. And as a part of that team, you are in charge. You have to learn a lot about your diabetes. You have to learn what it is, why it happens, and how best you can control that. You know, it's very important for persons who have diabetes to recognize that there are millions of people who have diabetes, and so you're not alone. And if you know that, then that process of taking care of it, knowing you're a part of a team, is going to be able to help you manage your diabetes, because it is controllable with your management.
Okay. And does the type of care, well, first of all, I know there are two types of diabetes, right? Type 1 and type 2. And what's the distinction?
So type 1 diabetics are the persons who have little or no insulin, basically. So they depend on insulin. They have to have insulin for their survival. Type 2 diabetics, which is the more prevalent of the two classifications, they have some insulin, but it doesn't work right.
Okay.
The amount of insulin that they have is in abundance, but it's not working correctly. Remember I mentioned before that insulin is the key?
Yes.
So basically their key is kind of not working, so therefore the glucose cannot be transported over to the cells effectively, and so that's what happens with the type 2 diabetes. Not that they don't have insulin, but they do, but it's just not working correctly.
So which one has to get the insulin injections?
So
One or two?
both may need insulin. One will require it. Type 1 diabetics cannot be on pills. That will be contraindicated. And so type 1 diabetics have to have insulin to survive. Their body doesn't make enough of it. Type 2 diabetics, sometimes they can begin in a lifestyle mode, or like you said, your friend needed insulin initially, but then doesn't need it anymore. So both of them can be dependent on insulin, but one will require it. So it's not as if you can say one or the other. I mean, at the end of the day, most type 2 diabetics will require insulin.
And you know what, Dr. Barzy, I know that there are a lot of misconceptions, and one of them, especially for the Hispanic community, is the pills versus injecting yourself. My family in Puerto Rico, my uncle has diabetes and he takes the pills. And, he was having a conversation with my mom, who's also diabetic. And, he was telling her, over in the Virgin Islands, I hear that all the doctors are just giving, you insulin to inject. Well, here we use the pills because the injections are no good. And I'm like, what's the difference? And, is one better than the other? And is there an overuse of the prescribing of the injections?
Interesting. She's asking the prescriber, the number one prescriber of the insulin, because I know by the pathophysiology that is necessary. So when I came, I guess, I'm not sure how it all started, but a couple patients came in and told me that I'm known as the injector, the person who's giving only the insulin.
You're talking about Dr. Barzy.
Right.
Your uncle is talking about
Oh my
me.
God.
I think he must be talking about me. And you know what? I try to explain it as simply as this. When you get diabetes, you think of your insulin level as a tank, right? You have a tank full of insulin. So in order to get diabetes, that insulin tank is going to be diminishing. It's going to go smaller and smaller and less. Pills do not replace insulin.
Oh,
There's absolutely no pill that's insulin, glucose. None of the pills are.
What is a pill?
So the pills are simply going to work on the different organs to do different things. So certain pills will work on the end of the liver. Now the liver is separate from the pancreas that makes insulin, and the liver makes sure that the brain has glucose. Glucose has to survive for the brain to survive, and the liver's sole job is to make glucose. So certain pills suppress the amount of glucose that the liver puts out. Other pills make the insulin that your body has work a little bit better. And then other pills do the same thing by pulling the glucose into the muscles. But insulin is necessary to replace that tank as it's diminishing.
So then let's talk about a care plan. I know you have a slide on that too. Just give it, for our audience, just give us like a 5-point care plan.
Well, a care plan must involve your meals. You must think about making sure you have an appropriate meal plan. Now that is very difficult for persons here in the Virgin Islands because when they hear meal plan and probably in Puerto Rico,
Yes.
they think I can't have my fungi, I can't have my rice and peas, I
yes.
can't have my peas and beans or plantains. Or,
Yes.
Right, but it's not about that. A nutritionist is one who's going to be able to help exactly. But the key to here is portions.
Okay,
Portions,
control,
portions. You
okay.
can have all of your favorite foods,
Okay.
but it has to be in the right portion. Correct.
Okay, so in terms of, so we have lifestyle, we have diet, and clearly anything else we need to manage.
So you have your meal plan, you have your activity, and then you will have you're seeing a physician and you will determine if medications will be necessary. If medications are necessary, you must know what the medications are, how to take the medications, when you should be taking them. Another very important part of your plan is you got to test.
Okay,
If you don't test your blood sugar, then you will have no idea what the number is going to be. In order to test, you can take control of management. You don't wait till the next 3 months to get to the doctor. If you're testing, you know two things. My food portions are working fine, my activity is working fine, or my medicines are working fine. You need to know that by testing. So it's very important to test. And the how has to be a special plan, an individualized plan for testing. That's probably best to say.
So then mommy isn't testing enough.
I know. I'm
but,
sorry, Mommy.
But you know what? When we come back, we'll talk about insulin and how insulin actually works. Since you're talking about insulin so much,
okay.
we want to get some
Yes, I'm the
insight on
insulin
that.
lady, huh?
So stay tuned when we come back with Dr. Judy Varzi, endocrinologist.
Yeah, yeah, yeah. This is the day the Lord has made. Rejoice and be glad in it. Yeah, yeah. Morning, morning. This is the day the Lord has made.
Welcome back to Good Morning V.I, where we are talking about diabetes. It's Diabetes Talk today, and we're talking with Dr. Judy Varzi about diabetes. She is a specialist in the area. She's a specialist in internal medicine and in the area of endocrinology. And diabetes in particular. So let's go on. What about, as far as diabetes, is it preventable?
Good question.
So for a lot of people, it could be preventable, especially if you're looking at lifestyle. And that's why I think certain type 2 diabetics usually hear exercise, lose weight. And if you exercise and you lose weight, then you don't get diabetes. But I always want to caution, how many people do you know who are obese? A lot. And of the population that you know who are obese, how many have diabetes? It's not as simple as that, exactly. So it's not just about being overweight and not doing that. And that's a very important misconception, especially for family members and support ones to know that it's not just about being overweight. It really has a lot of difference. But if you're type 2 and have some weight, you would be able to lose weight and help prevent some of the complications and reduce your need for maybe some medications if you have diabetes. So that's also, important in that sense. But preventable, it's still all about, did you have the right genetic exposure and the right environmental exposure, and why did it trigger in you and not me? And, and can it trigger at another time? So preventable being lived in a nice, healthy lifestyle that way, but it
So that
still
can
may
lower
come.
the risk, but as far as preventing it, maybe so, maybe not. But it at least can lower your risk when you
It
have
definitely
a
can
healthy
lower your risk
lifestyle.
if you have a healthy lifestyle, because then the theories are that fat won't get deposited in the wrong spaces, making it more likely now with your genetic exposure to be the reason that the environmental reason, whatever that may be, may trigger, for you.
It's one of those places, because I had heard also about the size of your midsection, that tells whether or not
You're going to be a diabetic?
Yes, even if you may not be obese, but then your midsection is quite large.
Well, it's all
as
about, just like I
opposed
said,
to-
where the fat is depositing, and if the
Okay.
fat is depositing around your organs versus in your organs, and so
Okay.
for heart disease and risk factors, we use a lot of those because the risk for the metabolic syndrome is a lot of those parameters all fall together and put one at increased risk if you have an abdominal ratio that's higher than it should be.
Okay.
So,
We
yes.
talked about in a previous segment about testing for diabetes. Now, are there any particular times or manners in which you should test?
Well, for most people, it's going to still be individualized according to what plan they're on, whether they're on insulin, whether they're on pills. But in general, if someone is taking oral pills, they need to be testing as frequently as 8 to 10 times would not be as necessary, but it's certainly important to test if they're taking oral pills. After your meals would be a very important time, 2 hours after a meal, because then you'll know what effect the meal has and what portion of carbs you had that could affect the blood sugar. Sometimes it's important to test at bedtime for certain populations, just depending on how you're feeling going into bed. Our blood sugars will naturally drop at night. So testing at bedtime is important, because if you're less than 110, you may want to take a snack. If you're, depending on the numbers, very important that, what everybody, your viewers are hearing is that numbers are specific to your care plan. So what I'm speaking about are just general numbers. You may have heard different numbers from your different team members, healthcare professional that's taking care of you currently, that you would have to then apply.
So it isn't individualized.
More so, yes. We have general terms that we use, certain targets that we might want to reach or achieve, as we have a slide to show probably later.
We have another slide too, which, well, the question is, what are the ideal blood sugar levels?
So the hemoglobin A1C is 1, 2 that I would like to touch back to. That level must be less than 6.5. So if one wants to know how well their blood sugar is doing, then wants to know what the A1C is. So I always ask my diabetics, what's your A1C level? If you're diabetic, you need to know what that is. So if you don't know, any of the viewers that are listening, make sure that you ask your doctor, what's your A1C? Your target is less than 6.5 in most persons. Okay? We can certainly adjust those targets depending on the individualized care plan, but that's usually what it should be. If you are testing before meals, the blood sugar should be between 70 and 130, and on any random, testing of the blood sugar should be at least less than 180 in the different societies. That's about, what we usually recommend.
And how would you describe, like insulin? It's still a bit mysterious to me. Insulin, what is insulin?
Well, it's a natural hormone. It's a natural hormone, insulin is, and the way I tend to describe it, I guess, it's a medical breakthrough, meaning for a lot of people who had diabetes, both type 1 and type 2, the glucose levels are going to be extremely high. And the only way, if your body's insulin is not working correctly, or if you don't have enough insulin, for it to get fixed, so the glucose levels can go down and prevent some of the complications that we will discuss, you have to have insulin. So you're given this outside injection, because unfortunately insulin does not come in the form of a pill. They have to manufacture it and make it, and it's only made in an injectable form. A couple of years ago it was actually inhaled insulin, but that used to be, but that kind of didn't work. It worked fine, sorry, but we didn't, some of the physicians, it was a harder modality to get people to be using, so it kind of phased out, and we did, it's no longer, the company no longer markets it. Yes, we don't use the inhaled insulin anymore.
That's a good note. Coming up next in our next segment, Dr. Barzi is going to still join us on our next segment, where we're going to talk about the problems that could occur if you don't really pay attention and take control of the diabetes. So coming up next, stay tuned on Good Morning V.I.
Hey! Good morning, V.I. Good morning, morning. Wake up. Good morning, morning. Wake up. It's time to tune in. Good morning, morning. This is the day the Lord
Good morning. And we're here on Good Morning VI with Dr. Barzi with our diabetes talk. Welcome back, Dr. Barzi.
Thank you. It's been a pleasure.
Yes, it is a pleasure, and it's so educational. We're here learning, even off camera, about diabetes. And at this point, tell us about some of the problems that diabetes causes.
So I think for a lot of people, the first two short-term complications are the sugars can either be high or the sugars can either be low. And a lot of people tend to kind of blur those lines. If the sugar is low, you can have symptoms of feeling fatigued, tired, nervous, sweaty, irritable, hungry, blurry vision, and so if that's the case, then you want
No, I feel like I've been having symptoms like that lately, but I don't claim these things. Faith.
No, Faith.
Yes.
Okay, yes.
So that's initially.
Yes.
Okay.
And to treat the low blood sugar, if you have that, you will clearly take something with sugar. You can take some hard candy or some soda pop or juice, stuff like that. You want to be mindful to not treat the low blood sugar with M&Ms or things that have chocolate in them, because it will just make the process of bringing the blood sugar up much slower. Okay?
Oh, chocolate.
Chocolate's
Okay, no
not good.
chocolate.
No, hard candy, glucose tablets, juice or soda, at those times to treat that are probably the only times you might hear me say that, but not even too often because all those things, especially the juice, has tons of calories and we all don't need those
Okay.
extra calories every
Okay.
time your sugar goes low.
Okay.
Another one of the short-term complications of the sugars can be too high.
Yes,
And if your
yeah,
sugar
high
is
blood
too
sugar.
high, then one has to be adhering to your plan, making sure that the medications were okay, and if they weren't, then get those adjusted, in that sense, but spotting those symptoms. The bigger complications that you're probably alluding to are what we said at the top of the segment. You got amputations being a big thing. Now remember the blood sugars, if even they're not testing, it's going to go into every organ, your eyes, your kidneys, heart, your legs. So it's going to go into your nerves. It's going to go into all those systems. And when it goes, damage is occurring. So whether you know what your blood sugar is or not, it doesn't really matter. Damage is occurring. So a lot of people don't have symptoms and they feel fine. They're losing a lot of weight and they thought, oh, it's my new, plan, whatever it is. But be mindful that glucose is the energy that the cells needed and the calories that will feed the cells. So you could lose weight. And you could lose weight and it wouldn't be a good weight loss at all. And therefore, you have to know to prevent these complications. You have to know what those levels are and know what the targets are that we mentioned in the other section to prevent these complications, help prevent these complications.
Okay, and I think one of the things that we haven't mentioned, because I work with the elderly, a lot of times males who have diabetes, the first thing that happens is erectile dysfunction. I think that's one of the things I just wanted to mention because
Is it confined just to elderly males?
no, it's not. It's not. But Dr. Barzi can elaborate because
Well, I wouldn't say one of the first things, but
Okay.
yes, I mean, for a lot of people, there are different hormones, right, that regulate erectile dysfunction. And so you have to first make sure that the testosterone levels are appropriate.
Okay.
So before all my diabetic males out there go get all worried and
Yeah, I know, right?
let's
Spread the word, yes.
Yeah, it is definitely a complication. Why? Because it's nerves and blood vessels that are all regulated. And so if the blood vessels and the nerves are not all working right in any of your organs, your
Yes.
bladder, your genitals, any of
Okay.
those organs, then you're going to have a problem. But it's always advised to speak to the doctors first and make sure they get a complete hormonal workup and profile, because it may be that the erectile dysfunction is from a hormonal imbalance, such as testosterone being low, plus or minus the diabetes. So
Okay. And I just wanted to mention one more thing also. I don't know if it's a misconception, but yeast infections, getting, the many frequent yeast infections. They say, that
for men also, that's simply the fact that diabetes is not well controlled,
Okay.
and so you're going to get any infection.
Okay.
Yeast just being more prevalent, but you can get any infection, and that's one of the first signs. If your diabetes is not well controlled, then you get repeated yeast infections because
Yes.
your body can't clear that. Men can also get the same thing, yeast infection.
Good morning, morning. This is the day the Lord has made. Wake up, V.I.
some slides that talk about helping us cope. As you're saying, it's progressive and it's how do we cope?
I know.
A support system, Good Morning V.I. This is an awesome, forum to share support and to recognize that there are others, getting the word out and realizing that there are others who can teach us things. As a physician, I can always learn, and I can always keep on learning from my patients, and so can the audience from other persons that they know. If you go on websites, if you go on the American Association of Diabetes, if you go on to a couple of the slides speak about Novo Nordisk for changing diabetes. If there is, I'm not sure, is there a diabetes support
material.
group in the
Yeah,
VI?
I was
Is
about to
there?
ask you, actually.
I'm not sure.
Having moved here for 3 years, guys, I don't know. I'm not aware of one. I can't start one up either. I'm just a little too crazy and
Yeah,
busy.
of course.
But I think there may be one in St. Croix, maybe.
Okay.
I'm not certain. Yeah.
So some of the support materials, the literature and getting information from your doctor.
And talking to
websites.
persons who have diabetes and making
Okay.
sure that you are well informed about what they're saying, even bringing up some of the misconceptions to your physicians and getting those myths dispelled.
Yes.
taking
important.
insulin? Is it hard? There are many delivery ways, things that we can't probably even get into here. So how insulin delivery now is so much easier.
Right,
It's so much
right.
different than what people's thoughts are from what you remember and what your grandma used to do. And so it's quite different.
Is there a cure in the horizon? Is there, what is going on with the research?
So
Give us some hope.
For a lot of people, so about a year and a half ago I moved, and a patient left, needed to have dialysis because that's one of the complications of kidney, but didn't want to have dialysis, and actually went away and had a kidney pancreas transplant. So
Okay.
now they're back, don't require any insulin, don't require dialysis. So yeah, there are some people who could qualify or become eligible for those transplants. It still means a whole different set of chronic diseases with immunosuppressive medicines, and hard to have a transplant, but at least they're living a different life with that.
Okay.
But there are transplants that are available, but not for a lot, not for everybody, but certainly those things can be explored. And the research is persisting. The Juvenile Diabetes Association is putting out a lot of research and asking, for persons who have certain types of diabetes to enroll so that they can get the research going, and we need a lot of people here too to be able to enroll so they can see all populations and try to help, in different ways.
Oh, this has been so informative. Thank you so
Amazing.
much,
You're
Dr.
very welcome. It's
Barzi.
my pleasure.
Yes.
Anytime.
Yes.
You're welcome.
And as we end our diabetes talk on Good Morning VI, we're coming up with some inspirational words and your encouragement and homework for the week. So stay tuned on Good Morning VI.
Yeah, 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 yeah. Hey! Good morning, V.I. Good morning, morning. Wake up. Wake up, V.I. It's time to tune in. Yeah, yeah, yeah. This is the day the Lord has made.
Welcome back to Good Morning V.I. We have been having a diabetes talk today, and we've been talking with our special guest, Dr. Judy Barzi, who has been talking to us about all of the facts and sometimes some of the fiction regarding diabetes. I thought it was really informative.
Yes.
I really learned a lot.
Yes, so did I.
Yeah, almost too much.
I think so.
Like,
I think so, because I do have close family members, very close family members who have
Diabetes.
type 2. And I've never seen any real difference in lifestyle. They just live a normal life. So I've never thought of it as being anything that's, crippling or anything at all. And
could
so,
lead to the
for me, when hearing this, I'm like, wow, oh my God.
You have to spread the word.
I don't know. It's kind of disturbing, but then at least I mean there is the positive side that I've seen people who've had it for many years and they just live
Living.
lively, wonderful lives. So
Yeah.
it's really not
Which is important.
right,
to
right,
note.
and that is all possible. And of course, faith and
Yes.
it is God's will that we be in health and that we are healthy, so
Yes.
we can walk in God's will and really know that we can live a
Mustard
healthy
seed can
lifestyle.
move mountains.
That's
And,
right.
and,
Can
yeah,
move
and,
mountains,
you
that's
know,
right.
we talk about some of the empowerment, knowing that you're not alone, knowing
Yes.
that there are other people,
Yes.
being enlightened, and having faith that you will be well and you will be healed and you will be made whole.
I think that that's probably the best thing, like in talking about having that network of knowing people and talking to people, because I think it could be so inspiring for people who are diagnosed with it, that you say, well, so-and-so has it and so-and-so
They're
has it.
fine.
But gosh, they look great.
Yeah.
Oh, and then it can make them feel a lot better. You know,
Yes.
that it really
can be managed.
is right. It can be managed, and you can still have a joyful, great quality of life.
Yes, we can.
Yep. So I'm
sweets.
glad your mom's going to be fine too.
Yeah, of
Yeah,
course.
she-
Yeah, she looks great, by the way.
Yeah,
and that she is an example. You see her, and
She
she's
is,
active
yeah.
all the time. Yeah, that's good. Well, that brings us to our assignment for the week.
Assignment, yes.
So our assignment for the week.
Homework.
Okay, this is the homework. Okay, and if we're talking about faith, okay, speaking words of faith.
Okay.
Remember? Okay, the assignment of the week is start to reprogram certain areas of your life for success by regularly and consistently speaking words of faith to bring positive change into existence. Okay? So that is reprogramming. So that even
that's
comes
a
like
change.
reprogram.
Mind.
Right.
Positive words.
right. That's right. And remember, in speaking those words,
And you
speaking
have to
is so
say it out
important.
loud, right?
You have to say it.
Look at yourself in the mirror and say whatever.
Self-talk.
Yes.
Self-talk.
Positive self-talk.
Positive self-talk.
Positive self-talk, regardless of what it is, you know, because that's like really the first step. But so many areas in the Bible talk about the power of our words and the importance of speaking, saying it, and not saying certain things.
Yes.
Holding your
This is true.
tongue. Because that can cause, you know, the change, or, you know, change the course of nature and everything. So
We have the power to change the course. That's that moving mountain thing again. There
It's
you
the
go.
same, the moving the mountain.
There you go.
Yes, for our scripture today, that you can,
We
with
know
that,
we can
that,
do the
that faith
impossible.
of a mustard seed,
Yeah.
you can move mountains. All of us,
Just with
each
your
of us
words.
have
And we
that.
have.
And
You know, if we think about it, you know, if we
Yeah.
think about, you know, things that we've been through and how resilient we are, we have
right.
done the impossible.
Yeah.
Yeah.
This
We can
is
continue
true.
to do it.
This is true. I told myself I was going to live in paradise one day again. And here I am.
See?
Yes.
you see,
Oh, wow.
yeah,
It
we
happens.
do have that kind of power.
Yeah.
Well, what do you think? I mean, I know that you learned a lot, especially with your mom having it.
Yes.
And I wonder with Jalaise, how do you feel? I mean, you know, we love Tony the Tiger. I like Tony the Tiger too. You know, that
girl.
frosted flakes. So,
Oh, I
so
take that to my
you
house a
now
long
you know
time
you can
ago.
continue to
Yeah,
do
but
that, and you're not in
okay,
danger.
I'm relieved on the one hand that I can eat as many sweets as I want to eat, but then on the other, you know, there's that unknown factor, and I'm like, am I doing something wrong? But you know what, Faith? By faith, I will continue to enjoy
faith.
Tony the Tiger.
And
Yes.
moderation.
In
'Cause-
moderation.
Faith
Okay,
and
because
moderation. That's right. I mean,
You can't eat as much Tony the Tiger
as I
as
want.
Special K.
Okay. Well, so coming up next, of course, is our confession. Our confession for the week. Remember, again, this is the power of speaking, your self-talk. Our confession is what we would say, what you would say out loud to yourself, about yourself, that can change your life. And it is, I have faith and power to have victory in every circumstance in my life. I live a victorious life. Yes, that's it. Okay.
Love it.
Well, thank you so much for joining us. Until we see you next time on Good Morning V.I.
Tune in. Yeah, yeah, yeah. This is the day the Lord has made. Rejoice and be glad in it. Yeah.